Your blood pressure reads 128 over 78. Your doctor says it's fine, but you're dizzy when you stand. Your legs feel weak going upstairs. Last week you almost fell in the bathroom. Something doesn't match. And here's what's actually happening. That number on the machine and the pressure reaching your brain right now are two completely different things. In the next few minutes, I'm going to show you 10 common measurement mistakes that create false numbers and why your body is telling you the truth even when the readings say everything is normal. Let me be direct about what's happening inside your body. Blood pressure isn't one steady number. It's the force of blood pushing through your arteries with every single heartbeat. And that force changes constantly. When you're sitting, when you stand, when you walk, even when you breathe. For younger people, these fluctuations are usually modest because their blood vessels are flexible and respond quickly. But after age 65, your blood vessels become stiffer. The sensors in your arteries that detect pressure changes slow down. This means your blood pressure varies more dramatically throughout the day than it ever did before. So when someone measures your blood pressure once, in one position, at one specific moment, that single number might miss what's happening when you stand up to walk, when you get out of bed at night, or right after you take your medication. That's why you can have a normal reading but feel dizzy and weak. The measurement caught one brief moment, but your body is dealing with dangerous swings that never showed up on the screen. But there's something even more concerning that most people don't realize. The way blood pressure gets measured in most clinics and even at home is creating false numbers. Not slightly off, completely wrong, and these wrong numbers are being used to decide your medication dose. I'm going to show you exactly what causes these errors. But first, you need to understand something. If your medication was prescribed based on an incorrect reading, you might be taking too much or too little right now, and that mismatch is causing the symptoms you're feeling. Let me walk you through the 10 most common mistakes, starting with one that happens every single day. The first mistake is measuring blood pressure with a full bladder. This sounds simple, but what's happening inside your body is significant. When your bladder fills with urine, stretched sensors in the bladder wall send signals up to your brainstem, the part of your brain that controls automatic functions like breathing and heart rate. Your brain interprets bladder fullness as a mild stress signal. In response, it activates your sympathetic nervous system, releasing hormones like adrenaline into your bloodstream. These hormones tell your heart to beat faster and your blood vessels to squeeze tighter. The immediate result is that blood pressure rises, not by a small amount either. Research shows that a full bladder can raise your top number anywhere from 4 to 33 points and your bottom number by 3 to 18 points. Now picture this. You arrive at your doctor's appointment. You've been drinking water throughout the morning because you know staying hydrated is important. You're sitting in the waiting room, bladder getting fuller. Finally, you're called back, and within a few minutes, someone measures your blood pressure. The reading comes back elevated. Your doctor sees this number and considers increasing your medication or starting you on blood pressure pills. But that elevated reading wasn't reflecting your actual resting blood pressure. It was reflecting the temporary stress response triggered by bladder fullness. Now you're taking a higher dose than you need. When you're at home with an empty bladder, your pressure drops too low. That's when you feel dizzy, lightheaded, or unsteady. You think something's wrong with you, but actually you're being treated for a number that was never accurate in the first place. The second mistake is using only one arm to measure blood pressure without ever checking both. Your blood pressure should be nearly the same in both arms, with small differences of 5 points or less being normal. But if there's a consistent difference of 10 points or more between your left and right arms, it tells us something important about blood flow in your body. Let me explain what's happening inside. Blood leaves your heart through your aorta, the main artery. The aorta branches into smaller arteries that supply your arms, the subclavian arteries, which then become the brachial arteries in your upper arms. If one of these arteries has narrowing, which can happen from plaque, buildup, or stiffening, less blood pressure reaches the arm beyond that narrowing. So if you only measure the arm with lower pressure, you're getting an underestimate of the true pressure that's pushing against your brain, kidneys, and heart. Here's why this matters for how you feel. Your brain requires steady blood flow at adequate pressure. If your measured blood pressure looks normal, but that's actually the low side, and your true pressure is higher, your brain might be dealing with excessive pressure that increases stroke risk. Conversely, if your blood pressure medication is dosed based on measurements from only your higher pressure arm and your actual circulation is lower on the other side, parts of your body might not be getting adequate blood flow. This can cause symptoms like one arm feeling weaker, colder, or more numb than the other. There's also a more concerning reason for large arm-to-arm differences. Research shows that people with a 10-point or greater difference between arms have higher risk of heart attack, stroke, and circulation problems. This isn't meant to frighten you. It's information that helps you know when to seek further evaluation of your vascular health. Stop for a moment. Think about when you feel worst. Is it after you take your morning medication? Is it when you stand up from sitting? Is it in the afternoon when your medication peaks? Those aren't random symptoms. Your body is telling you that the pressure reaching your brain is too low at those moments. But because the measurements used to set your dose were taken incorrectly, nobody realizes you're being overtreated. Now here's where the next mistakes become even more critical. The third mistake is checking blood pressure right after activity without allowing time to rest. Your blood pressure doesn't settle the instant you sit down. When you walk, climb stairs, feel anxious, or rush to an appointment, your nervous system activates, stress hormones release, your heart rate rises, your blood vessels constrict. All of this pushes your pressure higher temporarily. That's normal and healthy, your body delivering more oxygen when you need it. But here's the critical part. After you stop moving, it takes time for everything to calm down. Your heart rate needs to slow. Your blood vessels need to relax. Your stress hormones need to clear from your bloodstream. For most people, this takes 5 minutes minimum. For older adults whose nervous systems respond more slowly, it takes even longer. Now think about what usually happens. You walk from the waiting room to the exam room. You've been worried about the appointment. You sit down, and within 30 seconds, someone wraps the cuff around your arm and measures. That reading reflects your activated state, not your resting pressure. It's 10 to 15 points higher than your true baseline. That elevated number goes in your chart. Treatment decisions get made based on it. And once again, you end up over-medicated for a pressure level that wasn't real. Then at home, when you're truly resting and taking your medication as prescribed, your blood pressure drops too low. This is when you experience the dizziness, weakness, and fogginess that makes you feel like something is seriously wrong. The fourth mistake has to do with where your arm is positioned during measurement. This creates some of the most common and significant errors. Blood pressure isn't uniform throughout your body. It's highest in the arteries leaving your heart, and it gradually decreases as blood travels through smaller vessels. But there's another force at play: gravity. When your arm hangs down at your side, gravity pulls blood downward, which increases the pressure in the blood vessels of your lower arm. When your arm is raised above your heart, gravity works against blood flow, which decreases pressure in those vessels. This is why arm position during measurement matters so much. The standard for blood pressure measurement is to position your arm so the cuff, specifically the middle of the cuff, is at the same level as your heart. When the cuff is at heart level, the pressure measured in your arm closely matches the pressure in your central circulation, which is what matters for your brain, kidneys, and other vital organs. Let me show you what happens when this is wrong. If your arm is resting on your lap, which is below heart level, gravity adds extra pressure to the blood in your arm. The blood pressure cuff reads this artificially elevated pressure. Studies show this can add about 4 points to both your top and bottom numbers. If your arm hangs unsupported at your side, which is even lower, the effect is greater, 6 to 7 points or more on your top number. Now imagine your blood pressure is actually 130 over 75, which is reasonable for many older adults. But because your arm is positioned low during measurement, it reads as 137 over 79. Your doctor sees this as borderline high and increases your medication. Now your actual blood pressure, when properly measured, drops to 115 over 65. For some people, especially older adults with stiff arteries, blood pressure this low means not enough pressure to push blood up to your brain when you stand or move. You feel dizzy, you feel weak, you might even black out briefly. The correct position is to sit in a chair with a table or desk beside you. Rest your arm on the table so that the middle of your upper arm, where the cuff sits, is level with the middle of your chest. Your arm should be relaxed, not flexed or tense. This positioning ensures that the measurement reflects the true pressure in your central circulation without gravitational distortion. But wait, some of you are thinking, my numbers are actually low when measured, so why do I still feel dizzy? Here's what's being missed. All those measurements, every single one, were taken sitting down. Nobody checked what happens to your pressure when you stand up. And that's where the real problem is hiding for many older adults. This brings us to a mistake that explains more symptoms than almost anything else. The fifth mistake is only measuring blood pressure while sitting and never checking what happens when you stand. When you stand up from sitting, gravity pulls blood down toward your legs. Normally, sensors in your blood vessels detect this drop instantly. Your nervous system responds within seconds, squeezing blood vessels in your legs and abdomen to push blood back up to your brain. Your pressure stays stable. But after age 65, this system becomes sluggish. The sensors respond slower. Your blood vessels don't constrict as quickly. The result is that when you stand, your blood pressure drops significantly for the first minute or two. If it drops by 20 points or more on the top number, that's called orthostatic hypotension. Your brain suddenly isn't getting enough blood flow. You feel dizzy, lightheaded, weak. Your vision might dim briefly. You might grab onto something to steady yourself. This is one of the leading causes of falls in older adults. Here's the problem. If blood pressure is only measured sitting, this dangerous drop never gets detected. Your sitting pressure looks fine, 105 over 78. But when you stand, it crashes to 95 over 55. Nobody knows because nobody checked. You keep being told your pressure is well controlled, but you keep feeling dizzy and weak when you move around. The numbers and your symptoms don't match because they're measuring the wrong thing. This is why you feel worse when getting out of bed in the morning, when standing up from a chair, when walking to the bathroom at night. Those are the moments when your blood pressure drops, but nobody's measuring it. Your body is giving you clear signals that something's wrong, but because clinic measurements only capture sitting pressure, the real problem stays hidden. The sixth mistake is using the wrong blood pressure cuff size. This is probably one of the most common reasons for getting inaccurate readings at home. Blood pressure cuffs work by inflating around your arm until they temporarily stop blood flow in your brachial artery. The device then detects when flow resumes as the cuff deflates, which allows it to calculate your pressure. But here's the critical detail. The amount of external pressure needed to occlude your artery depends on how much tissue is between the cuff and the artery. If the cuff is too small for your arm, it takes more inflation pressure to compress the artery through the surrounding tissue. This makes your blood pressure reading come back higher than it actually is. Conversely, if the cuff is too large, it may require less pressure, potentially giving falsely low readings. This is a particular issue for older adults whose body composition has changed over the years. You might have lost upper arm muscle mass but retained soft tissue elsewhere. Or you might carry weight differently than you did decades ago. Standard cuff sizes that worked when you were younger might not be appropriate now. So how do you determine the right cuff size? Measure your arm circumference at the midpoint between your shoulder and elbow. using a flexible tape measure. Once you have that number, you need to match it to a cuff where the inflatable bladder inside covers 75 to 100% of your arm circumference in length and 40 to 50% in width. Most blood pressure monitors come with cuff sizing information, and you can purchase different cuff sizes separately if needed. This might seem like unnecessary precision, but if your cuff is too small and your readings are consistently 8 to 10 points higher than your true pressure, you might be taking medication you don't need. The side effects you're experiencing, dizziness, fatigue, confusion, might be from overtreatment, not from your underlying condition. The seventh mistake is placing the cuff over clothing instead of on bare skin. This seems like common sense, but it's violated frequently. People roll up their sleeves and measure through fabric, or they roll sleeves up so tightly that it creates a tourniquet effect above the cuff. Both scenarios introduce error. Here's what happens inside. Thick clothing adds an air gap between the cuff and your skin. This air gap affects how pressure is transmitted from the inflating cuff to your arm. The cuff has to inflate to a higher pressure to get an accurate reading through the fabric barrier, which can make your blood pressure appear higher than it actually is. The error might only be a few points, but those few points can be the difference between normal and elevated readings. The other problem is when people roll up tight sleeves. If you push a sleeve up your arm and it creates a tight band above where the cuff sits, that tight band compresses your blood vessels. Blood flow above the measurement site becomes restricted. This changes the dynamics of how blood flows through your brachial artery during measurement, which distorts the reading. The solution is straightforward. If you're wearing clothing with sleeves, take your arm completely out of the sleeve before measuring. Don't just roll it up. This ensures that the cuff makes direct, even contact with your arm and that blood flow above the measurement site is unimpeded. The eighth mistake is measuring blood pressure within 30 minutes of consuming caffeine. Caffeine is a stimulant that affects your cardiovascular system in several ways. It blocks receptors in your brain for a chemical called adenosine, which normally helps keep your blood vessels relaxed. When caffeine blocks these receptors, your blood vessels constrict. At the same time, caffeine triggers the release of adrenaline, which increases your heart rate and further raises blood pressure. These effects begin within 15 minutes of consuming caffeine and can last for several hours, with the peak effect occurring around 30 to 60 minutes after consumption. Research shows that caffeine can raise blood pressure by 8 to 12 points temporarily in people who don't consume it regularly, and even in regular caffeine users, there's still a measurable acute effect. Here's why this matters. If you have your morning coffee and then immediately check your blood pressure, that reading might be 8 to 12 points higher than your true baseline. If you record this elevated number and share it with your doctor, or if it leads to medication adjustments, you're basing treatment decisions on a temporary spike rather than your actual resting pressure. The practical approach is to either measure before having caffeine or wait at least 30 minutes after consumption to allow the acute effects to diminish. The ninth mistake is measuring blood pressure after recent alcohol consumption without understanding how alcohol affects your readings. Alcohol has what's called a biphasic effect on blood pressure, meaning it affects pressure differently at different time points after consumption. Research shows that having 3 or more alcoholic beverages initially lowers your blood pressure for up to 12 hours after consumption. But then for the following 12 to 24 hours afterward, blood pressure increases above baseline. This means that if you've had alcohol recently, within the past day, your blood pressure reading might not reflect your typical state. If you measure during the first 12 hours, your pressure might appear falsely low. If you measure during hours 13 through 24, it might appear elevated. Neither reading shows your true baseline pressure. You don't need to memorize these time windows or avoid alcohol entirely. The practical takeaway is this. For the most consistent and meaningful measurements, avoid alcohol for at least 24 hours before checking your blood pressure. Or, at minimum, be aware that recent alcohol consumption adds variability to your results. If you're tracking your blood pressure over time to look for patterns, Having some measurements taken after alcohol and others taken without creates inconsistency that makes it harder to see your true baseline. Now, I need to tell you something that changes how you should think about blood pressure completely. Every number I've discussed so far, whether accurate or inaccurate, is just one moment in time. But your blood pressure at 8 in the morning is different from your pressure at 2 in the afternoon. Your pressure after eating is different from before eating. Your pressure on a stressful day is different from a calm day. And here's what matters. One measurement, or even 2 or 3 measurements, tells you almost nothing about what's actually happening in your body day to day. This brings us to the 10th mistake, which is perhaps the most important one to understand. The 10th mistake is making treatment decisions based on single blood pressure readings instead of looking at patterns over time. Blood pressure is not a fixed number. It changes constantly throughout the day based on activity, stress, sleep quality, meals, hydration, temperature, and dozens of other factors. This is especially true after age 65 because your pressure varies more dramatically than it did when you were younger. Your blood vessels are stiffer. Your autonomic nervous system responds more slowly. All of this means that one reading might catch a moment when your pressure was at its daily peak, or it might catch a low point. It might be affected by something you ate, how much water you've had, whether you slept well, or whether you were anxious about the measurement itself. So basing treatment decisions on one reading, or even a few readings, is like judging someone's weight by checking once after a large meal. It doesn't show the real pattern. Here's what actually works. For 2 weeks, measure your blood pressure every day at the same times, morning before medication and evening before dinner. Before each measurement, use the bathroom. Sit quietly for 5 full minutes with your back supported and feet flat on the floor, and rest your arm on a table at heart level. Take 2 readings 1 minute apart. Record both. After 2 weeks, you'll have 50 to 60 measurements. Now calculate the average. This average is far more meaningful than any single reading. It shows what your pressure actually runs, accounting for daily ups and downs. If your average is consistently elevated, that's real hypertension that needs treatment. If your average is normal but you're on medication, you might be overtreated. If your average is normal and you feel fine, you can reduce monitoring frequency. This approach gives you and your doctor reliable information to make informed decisions about your care, rather than reacting to isolated numbers that might not represent your true blood pressure pattern. Before we move to action steps, let me briefly mention wrist blood pressure monitors. These are becoming increasingly popular because they're convenient and portable. However, most experts do not recommend them for routine use if upper arm measurement is feasible. While some wrist devices have been validated in controlled research settings, they come with significant practical limitations. The sensor must be positioned precisely over the radial artery in your wrist, and your wrist must be held exactly at heart level during measurement. These positioning requirements are much harder to maintain consistently compared to an upper arm cuff. Research shows that in real-world use, most people have substantial measurement errors with wrist devices. The only scenario where a wrist device might be reasonable is if upper arm measurement is truly not possible due to arm size, injury, or other factors. Otherwise, an upper arm cuff with proper technique provides far more reliable data. Let me bring this together. You feel dizzy, you feel weak, you feel unsteady on your feet. Medical tests say you're fine, but your body is telling you something different. Now you understand why. If measurements were taken with a full bladder, your recorded pressure is falsely high. If your arm wasn't properly positioned, the numbers are wrong. If you weren't rested for 5 minutes first, you weren't measuring baseline pressure. If the cuff size is incorrect, every reading is distorted. If only sitting pressure was checked, dangerous drops when standing were missed. If measurements were taken too soon after caffeine or alcohol, temporary effects skewed the results. If you measured through clothing, that introduced error. If only one arm was checked, you might be missing important circulation differences. And if decisions were based on 1 or 2 readings instead of patterns over time, treatment might not match your actual needs. Your symptoms aren't mysterious. They're your body's accurate response to blood pressure that's either too low from overmedication, based on falsely elevated readings, or too variable with dangerous drops that never got measured. The disconnect isn't between your symptoms and reality. The disconnect is between your symptoms and the inaccurate measurements being used to guide your care. When blood pressure is measured correctly, with attention to all these details, the numbers and your symptoms start to align. You can work with your doctor to find the right treatment for your actual blood pressure pattern, not for measurement errors. Here are your specific action steps. First, measure your arm circumference at the midpoint between shoulder and elbow. Check if your blood pressure cuff is the correct size for that measurement. If you need a different size, order it. This is a one-time fix that ensures all future readings are accurate. Second, establish a consistent measurement routine. Empty your bladder first every time, no exceptions. Sit quietly for 5 full minutes. Don't talk. Don't check your phone. Just breathe normally. Remove your arm from your sleeve so the cuff sits on bare skin. Position your arm on a table so the middle of the cuff is at heart level. Take 2 readings 1 minute apart. This becomes your standard protocol. Third, check both arms initially. Measure the left, then the right. Compare the numbers. Whichever arm gives the consistently higher reading, use that arm for daily monitoring. Recheck both arms every few months to make sure the pattern hasn't changed. Fourth, avoid caffeine for at least 30 minutes before measuring. Avoid alcohol for 24 hours before your monitoring sessions, or at least be consistent about whether you measure after drinking or not. Fifth, if you experience dizziness or weakness when standing, add this to your routine. Measure your blood pressure sitting, then stand up and measure again after 1 minute. Record both numbers. A drop of 20 points or more in your top number indicates orthostatic hypotension, something your doctor needs to know about. Sixth, track your measurements for 2 weeks. Record the date, time, both readings from each session, and any symptoms you're experiencing. Calculate your average pressure after 2 weeks. This average, not individual readings, shows your true blood pressure pattern.